Trusting AI means being willing to rely on a system and to accept some level of risk because you expect it to behave in a particular way. Trustworthiness, however, is about whether a system has been designed and managed in a way that deserves that trust. AI tools tend to be more trustworthy when they have been developed carefully and responsibly. Trust tends to grow when people understand what a tool is for, how it works at a basic level, and where its limits are. In mental health care, trust is not about liking the tool or finding it convenient, but about understanding risk and responsibility. A helpful starting point is to ask, what is this tool claiming to do? If there is a clear, balanced explanation of its purpose, it becomes easier to judge whether it might be suitable for a particular situation. It's also important to ask who the tool is for and whether that includes you. A tool designed for adults may not be suitable for children or young people, and tools developed for specific groups or settings may not be appropriate for everyone. Trust depends on whether a tool is being used in the way it was intended. Another key consideration is transparency about evidence and testing. Trustworthy tools are clear about whether they are based on scientific or clinical evidence, how they have been evaluated, and whether their intended use means they should be regulated. Tools that support or claim to support mental health may need to meet specific safety and quality standards, and this should be made clear to users. How data is used is another important issue. You should always be able to find out what happens to the data you provide. This includes what information is collected, how it's stored, who can access it, and whether it's shared beyond the tool itself. If these details are hard to find or unclear, that may be a sign that the tool may not be appropriate to trust the sensitive mental health information. Another useful question is who developed the tool and why. If qualified professionals were involved and there is transparency about how and why the tool was created, it's easier to make informed decisions. If information about development, data use, or responsibility is missing, it becomes harder to make informed decisions. You can also consider how much human oversight there is. Some tools are supported by ongoing human involvement, while others are more automated. Understanding who is responsible for monitoring the system and what your own role and responsibility might be is an important part of deciding whether to trust it. In healthcare settings, trust may change with context. A tool may be approved, recommended, or provided by an organization, but that doesn't automatically mean it's suitable for every task. For example, some organizations may provide access to AI tools like Copilot, but this doesn't mean they're suitable for writing clinical notes or self-help. Deciding whether to trust AI in mental health care is about asking informed questions, understanding limits, and remembering that responsibility always rests with people, not the technology.